Cancer, also called malignancy, is an abnormal growth of cells. There are more than 100 types of cancer, including breast cancer, skin cancer, lung, colon, prostate, and lymphoma. More than 100 people around the world die each year from cancer. Experts project cancer deaths to rise to 13 million by 2020 if we do not act now. World Cancer Day aims to save millions of preventable deaths each year by raising awareness and education about cancer. At Medicircle, we are conducting an exclusive interview series on the occasion of World Cancer Day on the 4th of Feb, showcasing eminent oncologists over a discussion to bring awareness about cancer, its treatments, and myths related to it. Our guest for today's discussion is Dr. Gauri Shankar Bhattacharya. Dr. Gauri Shankar is a medical oncologist and clinical hematologist. He is currently serving as a medical oncologist at Salt Lake City Medical Center. He is the chairman of the SIOG Publication Committee and a member of WHO Steering Committee for Development of a Medical Devices List for Cancer Management. He is an editorial board member, reviewer, and publication committee member of many international and national journals. He has also published more than 200 papers and has been an investigator for more than 50 phase 2 and phase 3 clinical trials in translational research. Dr. Gauri Shankar has been awarded the Certificate of Recognition for Promotion and Development of Palliative Care in the World in 2013 by IAHPC. Hello, Dr. Gauri Shankar. Welcome to Medicircle.
I said, thank you, ma'am, for the introduction. I'm humbled. I honestly hope that I can do justice to this interview. Uh, let's begin, because I would prefer to not make this too academical, but speak from my heart, because I'm sure you're going to have a lot of viewers who are not going to be technical. They're basically going to be people who are seeking for knowledge, and that's what I would do.
Sure. So to begin with, Dr. Gauri Shankar, there are three most common types of cancer in India. These are breast cancer, cervical cancer, and oral cancer. So are they curable? And if yes, how?
Okay. Uh, I'm going to do something in Smita. I'm going to keep these three things that you said, these three cancers in mind, but I'll take one step backward and then start, because in that case I'll be able to maintain the continuum and the spectra for doing things. I'll start off with first saying that cancer is a complex ecosystem, both macro and micro. It's very, very complex. So if you don't try to understand the full ecosystem, we can never understand the disease process. To start with, the whole cancer care that we do, whatever field we are talking about, is actually patient centric. You're keeping the patient in the center and then moving through an entire gamut of players who are essential, and each player has a very important role to play, failing which we cannot actually work out anything. To start with, like I said, center patient, and then you have the government. Every government has to have a national cancer care policy, must have a national cancer care plan, which has to be dynamic because the society keeps changing very often. And as you just talked about, that one of the essential things is to know your numbers and your metrics. For that, have a good registry. So if you don't have a good registry, you cannot actually do good cancer care. So that's one thing that's very, very important that I think we should. Then come your commercial partners, and these are your people who develop your drugs, who develop your equipments, those who develop your caregiving systems, not caregivers, but the caregiving system. They're commercial players, and at the end, there has to be some method how that is taken care of. There is academia, knowledge base. The knowledge has to be created, research has to be done. So all this comes into play in that part. And then finally, you have the NGOs. Those NGOs may be working as non-profit, may be working as for-profit, but they have to be doing something to give the caregiver. And that's what I started. I can start by saying that NGOs play an important role because they play an important role of advocacy. They play an important role in telling the government what may be required because they are more at the grassroots than most people are. And then, of course, comes the payer who pays the money, the insurer, the individual, the government, and finally is the provider. Why did I say this? Is to just tell you that Each of this has to be developed. The providers, which includes doctors, nurses, pharmacies, right? Technicians. The manpower has to be developed. If you don't develop the manpower, you cannot do any justice. So the first part is keeping those three cancers in mind. And then comes up the issue, as I said, every step we go through it. Now, you started out by saying breast cancer. Yes, this is the commonest cancer in women, predominantly in the urban cancer. And we know something that this cancer is doubling itself up in a period of last 30 years as far as India is concerned. Now, as I said that, we need to have a policy how to do this. And because please remember, all the three cancers have something in common. They are detected late. They are usually in advanced stages. So at the end, your cure rates are low. Your survival rates are low at 5 years because you're seeing advanced patients. So the primary areas of working for us should be that one, detect the cancer early, right? Two, so that you can pick it up in an early stage so you have better results. Two is prevent the cancer. So, is breast cancer preventable? The answer is 35 to 40% breast cancers are preventable. And that calls for certain methodologies, certain means of handling them. And those are basically changing a lifestyle, following certain norms of living, avoiding birth control. I mean, I would say hormonal therapy without proper indications, not being obese, carrying out breastfeeding on a regular basis, etc., and being aware of your own breast. Unfortunately, in India, most women are not aware of the breast. So, you have got to get people aware of the breast so they can beware of the cancer. And for that, you have to educate the patients. So, health literacy and health education, along with advocacy, is an important part in improving outcomes in breast cancer or in cervical cancer or in oral cancer. For parts of all the other cancers, this follows the same norm. For example, being aware of the breast is that you have to go to know how to do your breast self examination, which I told you is an important part of awareness. You must know that you need to do mammograms in certain age groups and certain frequencies when risk factors are there, so you can have a early detection or you can pick up a early stage disease, because usually mammograph picked up cancers, early diseases. And then you need to have adequate treatment to see that you do well with the breast cancer. And then I said you can prevent it by certain means. Cervical cancer, it's a different sort of a ball game. To start with, is cervical cancer is a preventable disease. That prevention actually starts off being being aware of reproductive hygiene and being aware of menstrual hygiene. So you have got to understand that means the implication is for somewhere else. So you have to tell people about menstrual hygiene and reproductive hygiene, right? So menstrual hygiene would be somewhere around in age in India around 12, age of 12. So by that age of 12, you should be able to tell people about that so you can. If you watch carefully, that even without the vaccine, the cervical cancer has dropped in India. It is dropped in sheer numbers also, in fact. This drop has been because of menstrual hygiene improvement. And I call it the Procter and Gamble movement in India, in which they took it down into the districts and sub-district levels of carrying the method of handling and how to use sanitary napkins. The other game changer as far cervical cancer has been available of the vaccine. This vaccine can prevent cervical cancer, but it does not replace another important aspect of cervical cancer, and that is supposed to be screening and early detection. The advantage of doing a properly trained screening and early detection in cervical cancer is that by its the screening and its procedure can be curative. So that is the beauty of cervical cancer. Coming into oral cancers, This is a cancer which the Western world says that you cannot do early detection. There is no method of doing a self examination, which is not true. We have data that comes out of Kerala, parts of Maharashtra, that you can do an early detection of your mouth cancers by properly looking at your mouth in a well lighted room in front of a mirror, looking for white plaques, white patches, looking for areas which they may be slight bleeds, right? And having good denture. So, good oral hygiene, being aware of oral cancers, taking care of oral cancers, right, can prevent the oral cancer by using even a vaccine. But now, the most important caveat, the most important cause of oral cancers are two. That's 90% caused by tobacco and possibly 10% caused by the same virus that causes cervical cancer virus. So that vaccine can prevent cancer in the oral cavity. Similarly, if you stay away from tobacco, this cancer can be totally prevented. So now it comes up three things: oral hygiene, prevention of use of tobacco, and the vaccine can actually prevent this cancer, which may be more cost effective. When do you start? Start early. Start at school, telling them, if you remember, I remember as a child, we used to have those nursery rhymes. This is the way we brush our teeth, brush our teeth, brush our teeth. So that sort of thing has to be done to improve the oral care to see that happens. At this point of time, I will tell you these are curable cancers. All three of them, if they are picked up early, treated at the right center by the right persons at the right place in multidisciplinary team. So when I started, I told you this is a patient-centric disease. So patient comes in center of everything. At this point, I am going to tell you something that is 35% of cancers are infective in origin. Mainly, like stomach cancer, is caused by a bacteria called Helicobacter. Liver cancers, which is caused by certain viruses like hepatitis B and C. So you can prevent hepatitis B by using a good vaccine, C by early treatment, and Helicobacter by actually eradicating it can bring down. Similarly, there are other viruses like EBV virus, which causes lymphoma, etc. So that's the first question that you asked me, right? So let's move on to the next. What do you have to ask? Tell me.
So, in the passing years, Dr. Gauri Shankar, there has been an increase in the number of cancer cases. Like according to a study in India, with a population of 1.35 billion, witnessed as many as 1.16 million new cancer cases and 7,84,800 cancer deaths in 2018. So, what are the reasons and how can they be controlled?
Okay. To start with, let me start off by saying, yes, we are getting much higher numbers of cancers, which are rising. Unlike in the West, where some cancers are dropping, we still have not come to that case, we are rising. There are two reasons for it. One could be that we are detecting more cancers
Okay.
because we have moved technologically ahead. We have been able to use better technology. We are able to do better examinations. So we're looking at more patients. Point one, right? The second point is yes, the cases may be rising themselves, which is true. So, what causes these rises are a couple of things. Quite a few of these cancers are basically cancers related to lifestyle. Like if I told you that 35 to 40% of all cancers are caused by tobacco. So, by stopping tobacco in any format, okay, you may be able to bring down tobacco related cancers, and they are your head and neck cancers, lung cancer, bladder cancer, some esophageal cancers, some kidney cancers. So 35% of cancers are preventable by stopping tobacco, as far as India is concerned. Another 20% can be prevented or infection. These infections are like Helicobacter, which causes stomach cancer, I gave an idea, hepatitis B and C, which causes liver cancer. There are many more, a huge list. I'm not getting into that because that part can be prevented because you just need to take those vaccines beforehand. Take a HPV vaccine that can prevent your cervical cancer or some head and neck cancer, or even some anal cancers it can prevent. Okay, make sure that you have taken your proper shots. Get treated quickly for your infectious diseases. They can actually prevent cancers. So that's the second part of it. Third is lack of exercise and obesity is another more cause of cancer related. Now, you can bring down about 10 to 12% of cancer by proper dietary methods and proper exercises and get down to an ideal weight system when you do that. So, now, is there documentation to this? Yes, there is, specifically in colon cancer. If you avoid burnt meat, or if you avoid basically too many fried foods, right, or fatty foods, this does help. A brisk 20 minutes walk every day, 5 days a week at least, keeping your weight in check can help it. So these are methods. And in fact, if you were taking enough fruits and if you were taking enough vegetables, maintaining a healthy lifestyle and diet, staying away from tobacco, avoiding too much of drinking, or rather avoiding drinking totally if you can. For males, we say 6 pegs or around 360 ml of alcohol per week. For females, that is supposed to be 200. Not because there's a sex difference, but that's a body surface area and metabolic differences that bring forward that. So definitely these cancers are preventable. And in fact, I always would like to say, I wish most of developing countries governments would focus their angle onto this prevention. And I would always ask people who are going in for awareness and try to force things into advocacy that this may be the best focus that you can actually do it. I only can tell you, like I told you right till right now, is that I wish every school had an educator who would tell the ladies about menstrual hygiene. I wish there was a person who would go down to every males and tell them how to examine their own testes to find out a testicular tumor. And then if you could just tell people that how to look at your mouth, tell ladies how to look at your breast, that would be absolutely fine. And if you could help empower them or health educate them. So our mothers and sisters and our aunts do not feel shy in coming out and saying something is wrong in my breasts or something is wrong in my reproductive organs, which is very important, right?
So, a lot of people think that cancer is genetic. How true is this?
10% of cancers are genetic. Now, what I would say this is to put this just people to rest that yes, but let me tell you something. Cancer is a disease of the genes. That is, in a single part of the lifespan, the genes pick up certain changes which express themselves as cancers, right? But they are hereditable. That means passed down from one generation to another generation. That is from the mother to the daughter, father to the daughter, father to the son, mother to the son, and it moves it. That part of disease, which we say hereditable disease, that's about 10%, and that is true. And one should be aware today of it, and if possible, one should get tested for it when you know. And are there a method of selecting these patients? Yes, they are. These are usually patients who have more than one tumors. They're younger in age. There's a tendency for being bilateral. There are more than one person in the family who have similar or related cancers. They are people at a higher risk. There's a method of doing this, and that's called the Amsterdam and Gale model, which tells you who are these hereditary people. And today you have the genomic test, which actually tell you, which may cost you anywhere between 5,000 to 20,000 rupees, in telling you that whether you have it. Now, to make it sound that 5,000 rupees is nothing or 20,000 rupees is nothing, maybe, but please try and remember that in this country, still, we have 40% people who live below $2 a day. For them, that's a lot of money. So we need to find a method, how to make these things much more cheaper and easier.
Sure. So, thank you so much, Dr. Gauri Shankar, for joining us for this World Cancer Day Awareness series here at Medicircle. I definitely hope that our viewers would have a better understanding about this disease, especially how it is caused, what are the treatments available, and what are the different types, and what are the different myths associated. I think early detection and screening is really, really important. Also, if anybody is feeling any lump or any discomfort, white patches or something, anything along their reproductive organs or breast, they should be coming forward and asking. They maybe are having an issue and they must speak to the doctor about it or go for early detection. I think as early the cancer is detected, it is more easy for it to be cured.
I I am on the same page as you. I'm absolutely that the primary aim should be prevention. The secondary aim should be early detection. Third, it should be appropriate and right treatment. There's another aspect that we didn't talk about, time doesn't permit us, that once a person is cured, how he or she goes back to the society. That's called survivorship and leading a normal life, because the survivors are usually lost in transition. They develop stigma, stay away from the society, and they have their problems. So, honestly speaking, I think that's how it should be. And yes, we need to get into that part so that we can also get into a part that how to get the biggest comfort. Like I told you to start with, majority of our patients advanced. So one of the best things that they should be given is palliative and supportive care.
So again, thank you so much, Dr. Gauri Shankar, for joining us today, and thanks for your time.
Thank you, ma'am. Thanks a lot. And let's hope the year brings us good results. Thank you.